Hello everyone and welcome to Boundless Dentistry. In this video we'll talk about complications that arise after we have extracted the tooth. That is called as post-operative complications. Now most of the times we do try that we extract the tooth out of the socket without encountering any sort of complication, but every now and then we do encounter complications that do arise after we have extracted the tooth. So it is really important that we do identify such complications and after identifying manage them properly. So in this video we'll talk about all of those complications and commonly encountered complications that do arise after tooth extraction and how can we manage such complications. So let's get started. Now, firstly, let's talk about two types of complications that we encounter during tooth extraction procedure. Firstly, the first complication is called as perioperative complication. Now, what do we mean by perioperative complication? Now, perioperative complication means any complication that arises while we are performing the tooth extraction. So, during the procedure, any complication that arises, that is called as perioperative complications. But on the other hand, post-operative complication is that complication that arises after the tooth has been extracted out of the socket. Now, that post-operative complication can also arise, for example, like 1 day after, 2 days, 3 days, even after a week. So, any complication that arises after the tooth has been extracted is called as post-operative complication. Now, these complications are divided into three categories. They can be mild, they can be moderate, or they can be severe. Now, there are two things that we do to manage such complications. Either sometimes and most of the times these complications are mild. So, in those mild cases, we provide no treatment to the patient because they are self-resolving. They resolve on their own. They require no such treatments. But on the other hand, in moderate and in severe cases, some form of treatment is required for the patient. So either in mild cases we go for no treatment, and in severe and moderate cases we go for some kind of treatment being offered to the patient. Now, in this video, we'll talk about the commonly encountered complications after the tooth has been extracted. Now, these post-operative complications include trismus, hematoma, echimosis, edema, post-extraction granuloma, painful post-extraction socket, dry socket, infection, and delayed or disturbed healing. So, one by one, we'll talk about each of the complications in this video. Now, firstly, let's talk about trismus. Now, trismus simply means that there is limited mouth opening. Now, for example, before the procedure was started, the patient had a mouth opening of, for example, like 40 mm. But after the tooth has been extracted, the patient is experiencing some limitation in opening his or her mouth. So, that limitation can now be 30. So, initially it was 40 and now it's 30. So, now the patient is experiencing some limitation in opening in their mouth. For example, in this clinical picture, you can see it is being measured as to how much the patient can open their mouth, and you can see such limitation is present. There is some force being applied to open the mouth, but it is not opening. So there is some limitation in opening of the mouth, and this is called as trismus. Now, trismus can either be due to some muscle spasm. For example, while we are giving inferior alveolar block anesthesia, and sometimes we might injure the medial pterygoid muscle. Now, due to the medial pterygoid muscle being injured, there can be some muscle spasm. Now, that muscle spasm is temporary, and that most of the time it resolves on its own, and in some days mouth opening of the patient gets better and back to its original state. Now, sometimes traumatic surgeries are performed, and that traumatic surgeries can lead to edema, infection, and that then leads to trismus. Even when the duration of surgery is really long, and that long duration of surgery basically tires the muscles out, there is some spasm, so that also leads to trismus. And lastly, wound, hematoma, post-operative edema, all of these conditions then further lead to trismus. Now, after trismus has been identified clinically and as reported by the patients according to the symptoms, trismus is now being diagnosed. Now, how will we manage trismus? Firstly, we have to identify what is the cause. As for example, The cause is due to medial pterygoid muscle being injured by inferior alveolar block anesthesia, or duration of surgery, traumatic surgery, whatever the cause is. We have to identify the cause first. And in most of the cases, there is no such treatment required. It resolves on its own. But sometimes, if, for example, there is some acute inflammation, that is some infection or hematoma, we can ask the patient and we instruct the patient that they should do mouth rinses, salt, water, warm rinses the patient can perform. And in cases of infection mostly, we prescribe broad spectrum antibiotics to the patient in order to relieve the acute inflammation, and when the inflammation is resolved, it automatically improves the mouth opening of the patient. So this is how we identify and treat trismus as a post-operative complication. Now the next complication that develops after the tooth has been extracted is called as hematoma. Now hematoma basically arises when there is no proper bleeding control. For example, you have performed an extraction and you do not properly arrest the extraction socket's bleeding and you close the socket. For example, like in this case, you can see sutures were performed and now you can see some hematoma is developed. So if you do not properly control the bleeding, the blood starts to accumulate in the underlying tissues, and such clinical findings we find after the patient visits to us in, for example, 2 to 3 days after tooth has been extracted, because patient does complain of some pain and discomfort in the region where hematoma has been developed, as you can see in this clinical picture. Now the blood has started to accumulate inside the tissue and there is no escape. So since there is no escape, for example, you have closed the flap really tightly, so there is no escape of blood and that blood starts to accumulate, which you can see here and here. These are hematoma. Now after you have clinically diagnosed that the patient has developed hematoma, how do we manage? Initially, during the first few hours after the surgery has been performed, we apply cold ice packs and we continue that for 24 hours. Next, we can also go for heat therapy because it helps to relieve some swelling and associated symptoms with the hematoma. And then at times we may prescribe antibiotics, but prescription of antibiotic to such patients is debatable. Sometimes we do prescribe and sometimes we don't. That totally depends on the clinical situation. But we do prescribe patients analgesics because there is some pain because of accumulation of such fluid in underlying tissue. So we do prescribe analgesics, that is basically to relieve the pain of the patient. So this is how we clinically diagnose and manage hematoma as a post-operative complication. The third complication and a common complication that arises after tooth has been extracted, that is called as echimosis. Now, echimosis, as you can see in this clinical picture, the basic cause of encountering echimosis is basically there is some injury to the blood capillaries. Now, since there is some injury to the blood capillaries, blood starts to ooze out and accumulate in the underlying tissues. As you can see in this clinical picture, these all red and purplish and yellowish area that you can see is the accumulation of blood due to rupture of the blood capillaries. Now, at times when we are using retractors to retract the flap, this leads to injuring of the blood capillaries, so that might lead to development of echimosis. Now, after we have diagnosed that the patient is suffering from echimosis, how do we treat it? Basically, echimosis is not a serious condition. It does look like that there is something really wrong that is going on, but it is not a serious condition at all. There is no specific treatment. There is no specific treatment required for such patients, and echimosis gradually subsides after a few days. So it is a not serious condition. No specific treatment is required, and the echimosis in a few days it resolves on its own. So this is how we clinically diagnose and manage echimosis as a post-operative complication. Now, another common complication that arises after tooth has been extracted is called as edema. Edema basically arises when there is some soft tissue trauma whilst we are performing the extraction. So fluid starts to accumulate in the traumatized tissue. For example, as you can see, a tooth has been extracted over here and you can see the swelling, some swelling has developed in this region. So this is called as edema. Now, patient mainly report that this maximum swelling arises within 48 to 72 hours after the tooth has been extracted, and on the third to fourth day the swelling starts to subside. It gradually decreases and decreases, further decreases. Now, this edema can be classified as being small, moderate and severe. It depends on how much trauma that the patient has experienced whilst the surgery was being performed. For small sized edema, no specific treatment is required. We simply instruct the patient that he or she should apply some cold packs and it will automatically relieve on its own. But in cases of severe edema, immediate treatment is given to the patient because it can lead to further complications such as fibrosis, asphyxia. These are some complications that might develop after the severe edema has not been treated. And secondly, we do give patient intravenously hydrocortisone. This helps in decreasing the swelling of the patient and the size of the swelling, and broad spectrum antibiotics, because since there is edema and there is presence of bacteria, this basically helps to decrease the symptoms of the patient and to resolve this edema as soon as possible. So this is how we clinically diagnose edema and how we manage edema as a post-operative complication. Next, the complication that we have after the tooth has been extracted is called as post-extraction granuloma. Now, this complication basically arises after the tooth has been extracted nearly around 4 to 5 days. So after 4 to 5 days, this complication arises. As you can see in this clinical picture, a tooth has been extracted over here, but you can see some sort of tissue-like swelling is present over here. This tissue-like swelling, as you can see over here, which the arrow marks, is called as granuloma. Now, this granuloma basically has many causes. Some of the most common causes are, for example, we have extracted some tooth over here and that tooth had some amalgam filling. Now, the amalgam, if the tooth socket is not properly irrigated and clean, amalgam can accumulate in the socket and this can irritate the socket and lead to formation of this post-extraction granuloma. Some other causes include some small tooth fragment that has remained inside the socket. Even calculus at times can also cause this post-extraction granuloma. So it's really important that after the tooth has been extracted, proper irrigation should be performed with, say, normal saline. You properly irrigate the entire socket and make sure that there is no remnant of any structure present in the any part of the socket. So after we have clinically diagnosed that the patient is suffering from post-extraction granuloma, the most important treatment is basically we debride the socket and alveolus, so that if any irritating factor is present in the socket, we try to remove it and then automatically this granuloma resolves. So this is how we clinically diagnose post-extraction granuloma and how we manage it as a post-operative complication. Now, talking about one of the most common complications that most of the patients they do report after the tooth has been extracted is called as painful post-extraction socket. Simply, the patient is experiencing pain after tooth has been extracted. Now, this kind of pain basically arises after the tooth has been extracted, and because the anesthesia does wear off after tooth has been extracted, now the patient starts to feel some pain because the anesthesia's effect finishes. So after the anesthesia's effect finishes, now the patient does experience some pain. Now, this pain at times can be due to some sharp bony spicule that was present. For example, you have performed surgery and for example in interradicular region some sharp bony spicule is present, sharp bony margin is present. So this can irritate the overlying and underlying soft tissues, which can lead to development of pain for the patient, and this further leads to inflammation around the extraction site. So this is one of those causes which can cause painful post extraction socket. But some kind of pain after extraction is present. So normally we do prescribe patients some analgesics in order to relieve the pain that the patient is experiencing, and the patient is instructed most of the time that after the tooth has been extracted they should take analgesic if the surgeon thinks it is necessary. So it is the call of the surgeon whether they decide that the patient should take analgesics immediately or not, depending on how the procedure went. But if some sharp bony spicule is present over here, we have to smoothen the sharp bony margins in order to relieve the pain of the patient and the cause, and we prescribe analgesics to relieve the pain of the patient. So this is how we diagnose painful post extraction socket and manage it as a post operative complication. Now lastly, talking about one of the common and a painful post-operative complication that the patient does develop is called as dry socket. It is also called as fibrinolytic alveolitis. So this is dry socket. Now Dry socket mainly develops after 2 to 3 days after the extraction has been performed, and there are many etiologies and pathogenesis that has been suggested for this complication, but the most common thing is basically there is disintegration of clot, and that leads to necrosis of the bone socket. So there is failure or dislodgement of the blood clot that should develop in the extraction socket, and when that clot does not develop, this leads to dry socket. Clinically, as you can see in this picture, which we can appreciate, is that the socket is empty, patient does have bad breath, patient does experiencing bad taste because of accumulation debris, and that debris really gives patient a sometimes a salty bad taste. And as you can see in this clinical picture, the walls of the extraction socket, you can see they're denuded, and in this case, one of the most important symptoms that the patient experiences is severe pain, and that pain radiates to the head, jaw, and neck of the patient. And that is a really severe pain that the patient presents to us. Now, the cause that have been described for this pathology is basically sometimes there is difference of blood supply. For example, in maxilla, the blood supply is really good. So in maxilla, the development of dry socket is really less. But for example, in mandible, it has only one artery, that is inferior alveolar artery. So blood supply of mandible is not that good as compared to maxilla. So if something happens to the mandibular blood supply, chances of developing dry socket is more as compared to maxilla. So the difference of blood supply between the maxilla and mandible creates the difference of dry socket being encountered more in mandible as compared to maxilla. Sometimes infection is also an important cause. For example, in edema, pain, infection is the cause. So when there is some infection present already in the socket, that may lead to development of dry socket. Also, trauma at times and bone density can also be a factor, contributing factor for causing dry socket. Now, how do we manage a patient that has been clinically diagnosed as dry socket? Firstly, we perform irrigation of the socket. Now, by performing irrigation, we try to remove all of the debris and necrotic bone that is present at the base of the socket and all around the socket. So we try to remove it and clean it all over it. Then we perform some dressing. For example, eugenol, zinc oxide eugenol dressing we perform. This basically helps to relieve the pain of the patient, and this dressing is performed again and again over a period of, for example, 5 days, until and unless the pain of the patient subsides. And we can also go for alternative such as idoform. We can also use idoform to relieve the pain of the patient. So this is how we clinically diagnose a patient who is suffering from dry socket and manage it as a post-operative complication. So in this video, we talked about the most common complication that we encounter after the tooth has been extracted, that is called as post-operative complications. We talked about edema, dry socket, painful socket, granuloma, trismus. We talked about all of these complications and how do we diagnose and manage it clinically. So I hope this video was useful for you, and if you like this video, please like, share, subscribe, and press the bell icon. Thank you for watching this video. See you next time.